Top 5 foot and ankle questions. This week somebody asked me about blisters. She had a blister, she just started running. She hadn't run in a few years, and she started running again, and she developed a big blister, and she didn't know if she could pop it, she didn't know if that was safe, not safe. And blisters are a friction phenomenon. So what will happen is your foot will be, maybe your shoe's a little bit big, and your foot is pistoning in the shoe. Or it's a little too tight, and there's just pressure on it when you're running. And so what will happen is the layers of skin will shear apart. There'll be a shearing force, and it'll fill with fluid, naturally occurring fluid from our body. And usually that's just a clear blister. And the truth is, it probably is okay if you put some alcohol on it and then popped it with a needle or something like that. Most of the time it's not going to lead to anything too detrimental. However, when there's blood in there, and depending on the location, oftentimes you could have a blister on top of a joint. And there could be a communication with the joint. So if you pop that blister, you expose your joint to the outside environment, and you could get bacteria in there, and that could be catastrophic. You could end up with a septic joint, and you could actually lose your toe or something like that. Okay, the second question is sort of a two-part. It's the second and the third question. I was asked several times this week, so I put them both in here. I'm going to kind of combine them. But the first question somebody asked me, is there a way to manage my bunions conservatively? Can I manage them without surgery? And the second question was, how do I know when I need surgery? So a bunion is a deformity that occurs at the big toe. The big toe usually starts drifting over towards the second toe, and you get a big bump right behind it. And oftentimes it is hereditary, usually through the matrilineage, through the mother's line. When you see you have that deformity, a lot of times people have pain because of pain on the bump. So the question is, how can I manage that? Number one, you need space in the shoe. If there's not enough volume in that shoe to hold your foot without rubbing aggressively on that metatarsal head, which is the bone that's prominent, then you're not going to be comfortable. It will hurt. And there's also a neurovascular bundle right there. So there's a nerve that's going to be pressed upon when you have a bunion deformity. However, if you buy a shoe that is wider and accommodates it, you probably could exist for a long time without any other treatment. They also make some splints that you can sleep in. They help counteract the deforming force. Usually there's a tendon that's pulling your toe in one direction, and it's out pulling the counter tendon that's supposed to be keeping it straight. And when that happens, the toe drifts over. Usually the deforming force in a bunion is we have two tendons that counterbalance each other. One pulls the toe this way, one pulls it this way, and it maintains a rectus attitude, a straight attitude. When one gains a mechanical advantage over the other, it will outpull it. And then that one gets stronger because now it has a longer lever arm, and it'll pull that toe harder towards the second toe. In doing so, it will stretch out the one on the other side and render it useless. When that happens, you have a bunion that's not going anywhere. Okay, next, how do I know when I need surgery? So I have 3 questions, and you have to answer yes to one of those 3. The first question would be, do you have pain every day? If you have pain every day with that, it's too easy to fix the bunion surgically to walk around all day, every day with pain. The second question is, okay, maybe you don't have pain. Maybe the answer is, no, I don't have pain every day. But when I do have pain, it really hurts, and I can't exercise, or I can't do my job. My job requires me to be on my feet all the time. So if your answer yes to that question, it's definitely worthwhile to fix it, because you don't want to lose time exercising. You certainly don't want to lose time working if you need the income. So that would make it worthwhile. Also, let's say, no, doc, I don't have pain every day. And it's not that bad that it limits my activity. I can still work, and I can still exercise, I can still run. But you know what? I can't find a shoe that's comfortable. Only when I wear open toe shoes, or if I wear like slides or flip flops, then I'm comfortable, but other than that, I'm never comfortable in shoes. Well, if you can't wear shoes comfortably, that is also a circumstance where surgery would be in order. So how long am I gonna be off my foot or my feet if I have surgery, if I have bunion surgery? So I'll just answer it like this. There's different types of bunions. Some are more severe and require a more complicated surgical approach. But your garden variety bunion, which is what most people have, in my office, you're pretty much off it for 17 days. I take your stitches out at 17 days. How painful is it? I don't even dispense pain medication for it. I never have patients tell me it's painful. And I'm telling you, I do not have patients complain about pain. Their biggest complaint is, how much longer do I have to be off my foot? And again, 17 days, I'll take your stitches out, and if your foot's not swollen, you can go back into a regular shoe. Sometimes you need to wear a little surgical shoe or a boot for a week or two afterward because you might still have some swelling, so it's just not that comfortable in a shoe. But in any event, that's the story with bunion surgery. And I can't tell you won't have pain after bunion surgery if other surgeons do the work, because I don't know what other surgeons do. But I can tell you in my practice, bunion surgery is not something that people complain about pain afterward. Okay, question number 4, warts. How do I treat warts? Warts is one of those things that there's a number of different treatments in the marketplace just over the counter. I'm not a fan of them. Usually they have some kind of acid preparation in it. Usually it's salicylic acid. And it's interesting, salicylic acid, like other acids, tends to take the path of least resistance. So if you put it on a wart, which is a lot of hard skin surrounding it, it doesn't tend to stay localized to that and eat away at the hard skin. It tends to go into your healthy skin and destroy your healthy skin and leaves you with a bigger problem, and you still have a wart. So I use a certain medication. As usual, I'm not going to name the medication because I'm not here to plug anything, but this medication doesn't burn, doesn't sting. It goes on like a lotion. You don't even know it's there, and you keep it covered, and the next day you can take the covering off and it does its job. There are times when it needs to be treated more than once, which is not a big deal. It's not painful. And so it's incredibly effective in children. By children, I say usually probably anybody 20 years and younger. They tend to do very well with it. For some reason, as we get older, it takes a few more applications, but it works great. It's painless. And to me, it's really the only way to do it. There are occasions when it has not been effective. Very, very few in the big picture, considering the thousands and thousands of warts that I've treated over the years. Very rarely do I need to do anything more aggressive, but every once in a while you have to numb up the area and just excise the lesions, and then the problem is cured. So if you're having problems with warts, it shouldn't be too big of a deal. It's usually readily treated with this medication that I use, and usually it's a very simple outcome, and it tends to be very satisfying. Last question of the day. Heel pain. Doc, how can I manage my heel pain at home? I don't really want to come in. I just want to try some things at home. What's the best way? Okay, so what are your activities? Okay, are you a runner? Because if you're a runner, that pounding is just gonna set you back. It makes it very difficult to heal if you're gonna keep pounding and pounding 5 miles, 10 miles, But okay, so whatever your activities are, you have to answer that question. But first and foremost, ice it before your activities, ice it after your activities. Icing is therapeutic if you ice it for 20 minutes 3 times a day, and meaning it can actually lend itself to healing the situation. If that doesn't work, sometimes people need to take a look at their shoes. Are their shoes worn out? Are they the right shoes for their foot? Are they comfortable? If you put on a pair of shoes and they're not comfortable when you start, a lot of times if you like the shoe, there's a tendency to say, well, it'll break in, it'll soften up a little bit. If it's not comfortable when you put it on, it's probably not the right shoe for you. And so I wouldn't even waste time with it. Find a shoe that's comfortable in the store, and it'll be more comfortable for you when you're running. And lastly, this is an interesting question. So one of the more common ways for doctors to treat it is to give a steroid injection. And people always ask me, yeah, but isn't that a Band-Aid? I don't want to do that because it's just a Band-Aid. My answer is no. This is a Band-Aid. A steroid injection, that was cute, right? A steroid injection addresses inflammation. It's an anti-inflammatory. Plantar fasciitis, which is the most common malady involving heel pain, is a problem of inflammation, as best as we know it. And oftentimes, when you treat it with an anti-inflammatory, it cures the problem. The goal is to cure it. A steroid injection is not a Band-Aid. I think that whole concept of a Band-Aid comes from like narcotics. And the reason we call that a Band-Aid, or somebody would call that a Band-Aid, is because the narcotics block the pain receptors, the mu receptors in the body, so you don't feel pain. But a few hours later, once it wears off and those receptors are exposed, you'll start to feel pain again. And so it was like a Band-Aid on there for a while. And it certainly doesn't go toward a cure. But a steroid injection is absolutely curative. It just doesn't always get the job done with 1 or 2. Sometimes you need a few, and sometimes that's not the best way. If the problem is more a biomechanical problem than it is an inflammatory problem, for different people, I think it manifests itself differently. But if it's more of a biomechanical problem, then you could take 15 steroid injections and it won't get the job done completely. and you just need to be in the right shoe and probably need a custom orthotic, which is an insert that goes in your shoe and it'll kind of control the way your foot functions when you're in it. But that's the story about, is a steroid injection a Band-Aid? It's not a Band-Aid. It can cure the problem. And so with that knowledge, I hope your heels feel better.